Tony Barbettini. I work at the St. John Clinic in Broken Arrow. I'd probably say I speak more commonly. I don't use all the medical jargon and lingo, the Latin and the Greek, just because I'm too stupid to remember all that stuff anyway. So I speak to the patient's level, explain things to the point where I think they understand it, and they feel comfortable understanding what's going on, what my thought process is. So, I mean, usually most patients are happier with that because sometimes I get responses that, the doctor never told me anything or they didn't have time for me. So, in my role, I can kind of expand on that a little bit more. It's very important, especially as a PA or a mid-level practitioner, because you're not a doctor. And so some patients are really hesitant to see you anyway. Well, you're not my doctor, I don't know you, you don't have the education, or they don't even know what the position really is. They think we're a nurse or something like that. So that's where the listening kind of builds their trust a little bit more, and taking the time to kind of cover their issues and make sure they understand their issues. Then they are more likely to trust you to follow the decisions you're making, or whatever guidance you're trying to give them, or medications you're prescribing or tests you're ordering. Why are you doing it? What does it do? What's the purpose? So that helps kind of build trust, and they feel like if you really did a good job, then they'll trust you, as opposed to, I'm never seeing that person again, I'll only see my doctor. Currently, most of it is babysitting grandkids. So there's 2 of those, because our oldest daughter is finishing up her fellowship in medicine. Other than that, try to do some little bit of music, play a little guitar. I'm currently restoring a car. We vacation a lot, scuba dive, just kind of whatever. I'm up for anything just about.